Women's heart health and good nutrition. Heart disease kills over 16 million people worldwide every year and is responsible for 40% of all adult deaths in the United States as well. Source: Natural News. Women tend to get heart disease later in life than men do, but it also tends to be more severe and more likely to be fatal. The number of women who die from heart disease is 6 times higher than that of women dying from breast cancer. Source: Hammer, 2005. Women's heart attack symptoms are different from that of a man and are more likely to be ignored or attributed to other causes, making them less likely to seek medical help at all. There are a number of risk factors for heart disease that are the same for men and women. However, there are a number of additional risk factors that should be addressed for better heart health in women. Risk factors include hypertension. High blood pressure increases the stress on the arterial walls, which in turn can lead to plaque deposits. Diabetes. It may lead to damage in the arteries and also raises both the blood pressure and the cholesterol levels. Poor lipid profile. Low levels of HDL, the good cholesterol, and high levels of LDL and triglycerides are risky. Smoking. This increases the risk of heart disease more than 5 times in women. Obesity. Central body obesity. Having a body mass index of 27 or more or a waist-to-hip ratio of 0.9 or more increases the risk. Insufficient estrogen. Postmenopausal women who are not taking estrogen replacement have the same level of heart disease risk as men who are 10 years younger. Sedentary lifestyle. The heart is a muscle and needs exercise. Lack of exercise also increases the chance of the other risk factors as well. Source: Hammer, 2005. Family history is another risk factor but not one that can be changed in any way. The other risk factors that are listed above can and should be changed. The easiest way to address the concerns and risk factors is with good diet and exercise. Losing weight can lower the blood pressure, control diabetes and the effects of the disease and help to change the lipid profile as well. Metabolic syndrome and heart disease risk. Metabolic syndrome is a grouping of different problems that can increase heart attack risk. Anyone who has 3 or more of these problems is considered to be at risk. These problems include obesity that is centered around the waist, having an apple shape as opposed to pear shape, high blood pressure, low levels of the good cholesterol, HDL, high levels of triglycerides and problems with sugar metabolism. Increased risk may also be established with the presence of C-reactive protein, CRP, in high levels. This chemical is produced in the liver as a response to inflammation. Testing for elevated CRP is done by blood tests, which are done 2 weeks apart with the 2 results averaged out. A CRP level of 1 to 3 mg per liter is moderate cardiovascular risk. Exercise to reduce heart disease risk. The American Heart Association recommends that everyone should be getting at least 30 minutes of exercise per day. However, many people fall short of this goal. Any exercise is acceptable and can consist of a walk around the block as you build up strength, lose weight, and reduce your risk factors for heart disease, diabetes, and other health conditions. Before starting a new exercise program, especially for those who are high risk and have been sedentary, a consultation with the doctor is necessary. It may also be necessary to have a stress test and other evaluations done to make sure that you are healthy enough for the exercise program that you intend to use. Diet to reduce heart disease. The American Heart Association, as well as other health agencies, suggests a number of different diets that are beneficial for heart health as well as to reduce a number of other risk factors. One of these, or dietary approaches to stop hypertension, focuses on fruits and vegetables while reducing the amount of saturated fats and sodium in the daily diet. A diet that reduces the amount of fat while slightly increasing the amount of protein can be very beneficial for a number of reasons. The higher level of protein makes the diet more satisfying, so there are no problems with deprivation or with the missing fat. The body has a set amount of nutrients that it needs to work correctly. If any of these nutrients are missing or are not in abundant supply, the body will send out the signal that we need to continue eating until the right amounts are reached. This is especially true of protein, which is needed in a number of functions and organs in the body. Carbohydrates are the primary energy source for the body and should make up the bulk of the diet at 50% of the daily calories. Fats and proteins, which are the other 2 macronutrients, should make up the other portion of the daily calories. For weight loss, protein should be around 25 to 35% of the calories but not any higher. Fat should then be 15 to 25% of the diet, but with a focus on only the good fats. At one point, the recommendation was for a smaller amount of fats, however, with all of the research being done that showed the benefits of good fats, especially omega-3 fatty acids, the percentage was raised slightly. Source: The American Journal of Clinical Nutrition. There are good and bad sources of all 3 nutrients and the best choices should be made as often as possible. Carbohydrates provide energy for the entire body and are the only energy source that the brain will accept. Without enough energy in the brain, thinking can become sluggish and systems can start getting shut down. Simple carbohydrates are the ones that are quickly and easily broken down. Blood sugar levels are raised quickly, leading to a flood of the hormone insulin which then leads to storage of most of the food instead of it being burned as energy. Complex carbohydrates, on the other hand, are slower to be digested, which does not cause the insulin surge that causes weight gain. Good fats reduce inflammation in the body, a response that causes weight gain. Bad fats increase the inflammatory response. Good fat sources include olives and olive oil, nuts and nut butter, or oils and avocado. Salmon and other fatty fish are also good sources of good fats. Protein is used by the body for virtually every cell and every function. From the central nervous system, protein is used to form neurotransmitters, to building RNA and DNA. It is used to build contractive tissue, muscle, as well as connective tissue, tendons and ligaments, for skin, hair, and nails. Protein plays a role in healthy eyes, digestion, sleep, and ovulation. Protein is important, but it is equally important that it's in a balanced amount. Too little protein and the body will seek other foods to get to the right level, potentially increasing the risk of weight gain. Source: Massey University 2009. Too much protein can also be problematic, causing problems such as kidney damage, liver damage, and digestive problems. Whey protein, a beneficial protein supplement, is prone to causing liver damage when used in excessive amounts, for instance. The best way to get the right amount of protein is through healthy, lean food choices, but occasionally using a protein supplement is a good choice as well. For some, ProfectR from Protica is a good source of high-quality protein with a very low calorie count and light, refreshing, fruit-based flavors.